Morning, tribe. I am so thankful that you have joined us today. We have Dr. Jessica Chung, who started her nursing career in 2009 with her associates and has just soared and pursued her doctoral degree in 2018 and now has her own practice. I'm so glad you've joined us, Jessica.
Thank you for having me, Chelsea.
Yes, so just introduce yourself. Tell us the important highlights of who you are and what brought you to where you're at today.
Well, everyone, thank you for joining in. I'm Dr. Jessica Chung, and as Chelsea mentioned, I started my nursing career way back in 2010 with my associate's degree. Originally born and raised in New York, down to Florida in 2011 in search of a hospital job because in New York it was kind of hard to find a position as a new grad nurse in a hospital. So I came down, I continued on and got my bachelor's. And then 2013, I went back for my master's, got my master's as a family nurse practitioner. And then lo and behold, I thought I was done. I really didn't have plans to go right back to school for my doctorate, but I decided to. So then went back in 2017 and then got my doctorate in 2018. And so I've been practicing. I've been a nurse, an RN for a total of 10 years. I was practicing as an RN for 5 years, and now I've been a nurse practitioner practicing for the past 5 years.
Awesome. That is quite a journey. And I know lots of people put in so many questions. So we're going to get through these as best we can. And those of you who are watching, feel free to add questions and we'll get to them. So when did you realize you had a passion for nursing as a career?
So I grew up with my grandmother was a nurse, and she was originally from the island of Jamaica. So she came to the States as a young woman. She was working as a home health aide. Then she went on and advanced her career. What was so amazing about my grandmother is that she went back to school in her 40s. She went back to get her bachelor's degree in nursing. So she definitely was someone who I spent a lot of time with. Any like summers or vacation, I would go with her to see her patients. She was a home care nurse, and I used to think this is so boring. But it really impacted me because I would see all the work she did. And so I tried to veer away from nursing for a long time. And then finally, I decided, you know what, it was something I should be doing. And so finally, I decided to go into nursing school. And I went into nursing school with the goal of being a nurse practitioner.
Okay.
I knew I had not heard of that position or that career prior, but once I found out about it, I knew that that was the reason for me going into nursing school.
That's really interesting. So what made you choose family nurse practitioning versus any other avenue of master's?
I definitely wanted to be in a position where I wanted to take care of patients and be an advocate for patients. So as an RN, as I gained more experience, I started seeing things especially in the hospital systems where I was like, something more could have been done, or patients are not getting the proper follow-up in the outpatient setting that they should. So I knew that I wanted to do something on the provider level, as opposed to, let's say, education or administration. I knew I wanted to be in the role of a provider.
Good. So how long did you say you worked as a nurse prior to going back to school? And do you feel like there's a certain rule of thumb that people should kind of go by?
So technically I went back for my master's in 2013. So I actually had been an RN only 3 years.
Okay.
Before I decided to go back to school. I definitely don't think there's any rule of thumb, because obviously you have to have that RN experience. So whether you're in school getting the experience and you go right from your BSN to your MSN or ADN to MSN, I think as long as you have some ground basic principles of nursing and patient care, and that qualifies you to go on and advance your career and your education.
Okay. So how would you describe your family nurse practitioning program? Were you able to work? What was that, big picture? What was that like?
So I was in my nurse practitioner program for 2.5 years, just about. So I started probably, I think, like the first year, I was still working like 3 12-hour shifts, in the hospitals. And I probably even worked more because, I was always trying to save more money. I would say in that second year of that program, things definitely slowed down for me as far as working, especially when I started clinicals. When I started clinicals, I realized I was like, okay, this is rough.
Yeah.
So, I mean, it would probably vary from me doing 3 12s to 2 12s.
Okay.
But I would say that last semester of my nurse practitioner program, I was down to working 1 day a week. I think I just made enough money to buy groceries and pay some bills. And that was it. My focus was finishing that program.
Yeah, for sure. So when you were working in the hospital, going through school, what type of nursing did you do to kind of bridge or prepare you for family nurse practicing? What was your role like?
So I always worked med surge. That was my main unit that I've always worked on as an RN. But I always floated to other departments. So I worked everywhere from the ER. I did a lot of ICU as well, PCU. I also worked in labor and delivery, perioperative. So I worked pretty much in most of the major departments in the hospital.
Yeah.
And I think what has helped me with that is that being able to see the different areas of nursing definitely has taught me some principles and some giving me knowledge as far as outpatient care in the family practice setting.
Yeah, that's great that you got kind of a broad spectrum overview.
Yeah.
So Philippe has asked, my ultimate goal is CRNA. However, during my time as an FNP, I want to work emergency medicine. I chose FNP over ACNP clinicals. However, it cannot be acute. Should I be doing postmaster ANCNP or continue on to CRNA for a more critical care experience? I've done nothing but critical care and emergency medicine, and I want to continue with that. Any suggestions on next steps?
All right. So she wants to, ultimate goal is CRNA.
Yeah.
So from what I know with the few CRNAs I know is that they had a background in critical care.
Right.
So you definitely want to get that critical care experience. And I believe some programs even ask you to have that critical care experience. So I think that you're on the right track going, staying in critical care if your ultimate goal is CRNA.
Yeah, and then F&P route due to the pediatric portion since AGA CNP doesn't provide pediatrics.
So when my mentees and comes and ask me what route should they take, I always tell everyone you have to do what you want. But if you are wanting to see a wide range of patients and kind of the job market is more open for FNP, then I say go the FNP route. Now, for example, pediatrics is not my favorite. I do see children, but it's the kids. It could be challenging sometimes, but nonetheless, I'm glad I have the experience as an FNP because I can see children. I know FNPs that do work in acute care settings. I have worked in acute care setting. So just depending on the employer in your state, you definitely can work in different settings as an FNP if you have the right training.
So you have to take different boards based on what your focus is going to be.
Yes, you definitely will take different boards. So for example, I would say if you definitely want to stay adult, then go the adult geriatric route as far as your education and your boards go. But if you do definitely want to provide care for pediatrics and that population, then go the FNP route.
Okay, good. So how did you choose which school to go to?
Wow. So I really, that's probably going back to 2013.
Mm-hmm.
I just probably did like a Google search. So I was very clear on the fact that I wanted to do a program that was flexible. I because I worked crazy hours and my schedule changed at the drop of a dime, I didn't want to be tied down to a program that's per se, let's say, they said come once a week, you have to sit in the class 6 hours, because I never knew what my schedule was going to be like. So I was very particular about choosing a program that was flexible and that I could work around my own schedule.
Okay. So did you do most of it online?
It was most of it online, and I tell people, just because things are online did not make it any easier. Exams were just as hard. You know, doing clinicals, you have to, you know, schedule yourself appropriately. So for me, it wasn't any different from being in a classroom live setting.
Sure. So when you're choosing an online program with clinicals, how do you ensure that they're going to match you with an appropriate clinical assignment, or did you take those factors into account?
So just going back a couple years, it was definitely not hard finding preceptors, and I know like now it definitely has become challenging. So the school I went to, which was South University, they had us find our own clinical sites,
Okay.
which I loved it because I was very close to home. I didn't have to drive very far from my preceptors and clinicals. So that was probably my main factor, is that I didn't want to be far from home, far from work, driving an hour or two, or even what I hear today, people are relocating for clinicals. And so I think that there was an advantage to finding your own clinical sites,
Yeah.
as opposed to, for some individuals, you may not want the stress of finding your own clinical site. So maybe choosing a school in which they to find clinical sites for you would be a better option.
Okay. And another question, how do you suggest we go about finding preceptors when we're not familiar with certain areas that are required?
Right. So I was pretty bold when it came to finding preceptors. I would like go to doctor's offices and I would just say, "Hey, I'm a student. I need a preceptor." So probably about, I would say, a good number of my preceptors, I literally just went into their offices and said, handed my resume and said, "I need a preceptor." One of my preceptors, he was a physician in the hospital, and I was on the floor that day, and I was like, "Hey, can you precept me?" And he was like, "Sure, call my office." And that was it. So I was very bold, and that's what you kind of have to do, because it's hard to find preceptors. And what I just want to preface and say, for those of you who are having difficulty finding preceptors, nurse practitioners are swamped. Physicians are even swamped, so it's hard and to accommodate students and teach them. But there's still preceptors out there that are willing to help. So don't give up on your search. But you definitely have to be ready and prepared. Have your resume ready. Network. Go to, you know, your council, your nurse practitioner council meetings. Network with other nurse practitioners. Go to, you know, CEU conferences. Network with physicians and other PAs and nurse practitioners, and you definitely will find someone who's willing to take you on.
That's great advice. Did you ever use LinkedIn or any of those platforms to get your name out there?
For clinicals, no. It was really like I would literally call
You just
and
hustled.
show up at the office.
Yeah,
Now I know with the pandemic that probably might not be the best route,
that's true.
but you definitely, I would say, definitely use LinkedIn to your advantage. Use emailing to your advantage, and but my thing, when students come to me, I like to have see their resume and their experience. So have present your resume, send your resume, email your resume, so that they see the experience you have.
Okay, good points. So, how did you weigh the cost of the program versus the increased wage you would be receiving post grad? It sounds like your mind was pretty made up that you were going to be FNP. Did you do a
Yeah.
lot of weighing it?
So to be honest with, I did not. So yes, I did look at cost as a factor.
Sure.
That was important. That was more so important when I was doing my doctorate, because I was a little older. But when I was doing my master's, it was more so about the program and not so much the cost. Yes, cost was a factor, but I'm one of those people. If I'm going to do something, I need to get it done. and cost wasn't something that I was too worried about. Student loans wasn't something I was too worried about. Even though, yes, I do have student loans, but it's not something that, it hasn't ruined my life. But I would definitely say my doctorate program, I definitely was more conscious of cost.
Okay.
Some doctorate programs were much more than others. And so I think I attended Samford University, and the cost was much less than other programs that I looked into.
Okay, that's good. So when taking the FNP boards, is it similar to our RN boards in that we can move state to state, but yet just pay the Board of Nursing to give us a license in their state? How does that work?
Yeah, so for the two main certifying bodies is AANP and ANCC,
Yeah.
and which one you decide to take for whatever track you're going. So, for example, like oncology nurse practitioners, they have a separate board. But let's say if you're going FNP, adult, geriatric, pediatric, you could take the boards wherever. And then if you decide if you live in Florida, you decide to practice in California, you just have to apply to that state for your license.
Okay. And there's some limitations in practice from state to state as well, right?
Yes.
Okay.
Every state is not equal as far as practice.
Yep.
So, for example, I'm in Florida, and we are getting, primary care nurse practitioners are getting full practice authority on July 1st.
Hey.
So that has been a fight for years now.
Yeah.
But let's say, like states like Arizona or Nevada, those nurse practitioners have had full practice authority for a long time.
Okay.
And then there's some states where they're not fully full practice authority, but they're not restrictive. So their nurse practitioners have a little more wiggle room as far as practicing independently. So every state is different as far as practicing independently or practicing with a collaborative physician.
Okay, so Felipe wants to know if you're not owning your own practice and you're working as a nurse practitioner in someone else's practice, which it sounds like you did that, right?
Yes.
Did you feel like you were treated as one of the providers, or was there a difference in the way that you were treated as a team member?
So, in some cases, I definitely felt like I was treated as one of the providers.
Okay.
But what you do have to kind of keep in mind when you're working in someone else's practice, you are not the owner of that business, and so the ultimate decisions are sometimes they're not made by you at all,
Sure.
and you do have to go with the flow.
Mhm.
There are sometimes if you are going into a practice that's been established and the staff has been there for years, just bear in mind you kind of have to gain the respect of the staff. At the same time, you kind of have to demand the respect as a provider. So that's something definitely I've experienced going into a practice and kind of, demanding my respect as a provider with the support staff. And but once you lay out your rules, they just have to go with it. But you never should feel like you're being overlooked. You never should feel like support staff is not respecting you. In that case, you should definitely speak with management about that.
Okay. And then any benefits on clinical practice to having your DNP over your MSN FNP? Should we immediately go after a doctoral license?
So I definitely am an advocate for the DNP. My DNP program was nothing like my MSN. It taught me a lot. I think it opened me up more to focusing on evidence-based practice.
Okay.
So not just why do I prescribe this medication, but focusing on the evidence of why we do this in our treatment plans. It also opened me up to healthcare business, believe it or not. So my DNP program really expanded in my knowledge on what it takes to really, be in the healthcare business, not just as a provider, practicing, but what does it take to be a leader in the healthcare world? And what is it that we need to change? What are some things that need to be done as far as improving patient outcomes. So for me, the doctoral program was absolutely what I needed. I'm glad I did it. I'm glad I didn't wait. If you, obviously, everybody's situation is different. I'm still single. I don't have any children yet. So I had all the opportunities to just go forward, as opposed to someone who, you may have children, you may be married. So there's some things you need to take into consideration. But if you know you want to go the doctoral route, by all means, just go for it. Look for schools that fit your criteria, and just go after it.
Yeah. So, when you first stepped on as a family nurse practitioner, what is that training as a nurse practitioner like? I mean, we know what the training as an RN, we're kind of slowly led into these more critical cases. What is it like for a nurse practitioner?
So when I did my clinicals, I definitely had some tough preceptors.
Yeah.
So I definitely had to come right and come correct when it came to making sure I was, down to like just forming an HPI. I had a preceptor. I love her even to this day. She did not let me do anything with the patient until I knew how to write a proper HPI. And
Okay.
so I love that, because now when I look at my students, I'm like, oh no, you gotta come on, we gotta fix this HPI. So I'm good with writing HPIs. I love the fact that I went through different all different types of preceptors, they came from all walks of life. They had different backgrounds, because I learned so much from each of them.
Yeah.
So my training definitely was intense.
Mhm.
I definitely would see a full patient load in some of my clinicals. I was very hands-on in my clinicals.
Okay.
I mean, as a student, I was in the operating room, with my women's health preceptor. She took me into the room with her to do DNCs, C-sections. I definitely had probably an above average experience
Okay.
as for family nurse practitioner clinicals. But I like I said, it's because I chose my preceptors.
Mm.
So that's what I loved about that, is I knew what I was getting.
Yeah, that's a great point in choosing your
Yeah.
own too. So we've been chatting for a while and we haven't even gotten to the big picture, is that you started your own practice. So let's get there. Okay. So, what made you choose to open your own practice?
So I knew I wanted to open my own practice.
All right.
I definitely so back then, when it was just an idea, I had no idea what to do. I honestly, I couldn't even find someone to mentor me, to help me. So I just started doing the research, and I was like, okay, how does, nurse practitioner open their practice? And even then, you couldn't find even a lot of information on the internet about it, because nurse practitioners were doing it, but they weren't, I guess, there wasn't a lot of information being shared about it.
Yeah.
So I was doing a lot of research. I went through my doctoral program, and, once I graduated, I started a business, but it wasn't a practice. I started my speaking and mentoring business, which I still do. So I was doing like public speaking engagements and things like that. And so people would come to me and was like, where's your office? I want to be your patient. And I'm like, I don't have an office yet. So then I was like, you know what? I really need to hone in on this.
Yeah.
So finally, after studying my board of nursing statutes, because the most important thing is that you want to make sure you're in compliance. You want to make sure that it's something that can be done. And so to just clear up some misconceptions, a lot of people ask, well, how does a nurse practitioner own a practice? Anybody can own a business. Anybody could start a business. So simply, I was just a nurse practitioner that was starting a business. So I decided to start the practice. I found a collaborative physician. In the state of Florida, the collaborative physician does not have to be on site. They
Okay.
do not have to do any chart reviews. They don't have to sign off on anything. So basically, all I needed him to do was be available by phone.
Okay.
Once I had that in place, got all the licensing and the certifications for the state, to make sure that, I had everything in place to operate as a medical office. I opened my doors and I started out as a house calls. So I
Oh,
was going to patients' homes and seeing them. And then I transitioned and I got office space. And it's been a great journey. It's a lot of work. It's definitely a lot of work, but I definitely wouldn't change it. I did work while I was doing my practice. So I would see patients after work. I would see patients on the weekends. I was seeing patients at all odd hours. People would come up to me in church after church, like, "Hey, can you help me? I'm not feeling well," and I would see them in the bathroom. But nonetheless, it's all a humbling experience because I was finally in a place where people were coming to me and said, "Hey, can I be your patient?" And I could finally say yes, as
yeah,
opposed to, no, I don't have an office yet, or no, I'm not set up to practice yet.
yeah.
So it has been experienced, and it still is.
So I love that you did house calls and then transitioned to a brick and mortar. That's genius. I love that idea.
Yes. So definitely is a great way to save money as you're building your business. It definitely, I mean, there's challenges, driving all over the place, seeing patients. But definitely, if I suggest if anybody's wanting to start a practice, you definitely want to start with a model that's low overhead.
And what made you decide to stop doing house visits and do strictly brick and mortar? Is there a reason?
Yeah. So some more opportunities came about that required me to have an office space.
Okay.
So one thing I teach my clients about is subcontracting, independent contracting, which is a form of self-employment. And
Okay.
so one of the contracts I have that requires me to have office space. And so I really looked at, the calculations of, having this contract and paying for office space, and it definitely outweighed the benefits, outweighed everything. I was still able to bring in a profit with the contract, so basically pay for office space, pay for supplies, and still be profitable.
That's great. So, what were the most critical things from a business standpoint? You talked about licensure and contracts and weighing your profit. Anything else from a business standpoint in terms of, I don't know, what else is there to think about from a business standpoint?
From a business standpoint, you definitely want to be mindful of financial cost.
Mm-hmm.
So I don't, unless you have the capital, unless you have the income, I don't suggest you just go out there and say, "I'm going to lease this office for $2,000 a month," and you're paying for something you have no patients, you have no clients coming in. So you definitely want to be smart about um, calculating your financial cost.
Sure.
So one thing I do with my clients is I do business plans. You got to have a business plan. You got to have something written out that shows what you're planning to do. You also want to look at your market. So like if you're going to start a house calls practice, well, in your area, how many house calls practices are there? Is your area saturated with house calls practice, or is there no one doing house calls practices? So you definitely want to look at the market of the type of practice you're wanting to start to see if this is something where you have low competition or if you're going to have a lot of competition. So you definitely want to look at your market. You definitely want to look at the type of clients or the patients that you want.
Mm-hmm.
Are you in an area where you can get the type of patients for concierge practice? Or are you in an area that the patients mostly have Medicaid? So you want to think about those things when you're starting your practice. And there's a lot that goes into, figuring out what to do and how to do it. And so, that's something that I advise.
So you specifically, okay, for two things. First, you're talking about clients and advising. It sounds like you actually help nurse practitioners start their own
Yes,
practice.
I do.
That's so cool. I didn't know that. Okay. All right. So that's amazing. I didn't know that that was part of your services. That's super cool. So I apologize that I didn't know that. That's
That's
amazing.
okay.
Well, now people can reach out to you and say, Jessica, I need your help. Okay.
Yes, please do.
That's great. That's great. Okay. So you mentioned Medicaid. Let's talk about that insurance piece of it. How do you make all that work? And what does that time look like for you?
Yeah, so just depending on what your state you're in. So, insurers are different for every state. Um, Florida is has been a little slower as far as credentialing, but it still can be done.
Okay.
Just and it really is state specific. COVID has definitely, in my opinion, sped up the credentialing process for some companies for nurse practitioners, as opposed to it could definitely take up to 6 months for credentialing. So my advice for anyone that wants to start a practice, as far as if you want to accept insurance, you definitely want to start that process sooner. Now, there are ways to start a practice where you're just cash services only.
Oh,
So you could do a concierge practice in which obviously that's just cash based services. You could do direct primary care, which is something I do, where your patients pay a monthly fee for your services, which doesn't involve any insurance. IV hydration businesses typically don't involve any health insurance. So there's definitely routes you can go with insurance based practices and cash based practices.
that's amazing. I didn't know that. Um,
Yep.
That's so cool. So Felipe asked, do you suggest opening a business with someone so they can focus on the business and legal aspect and you can focus on the medical part? How do you do that in terms of staffing and co-owning? Share your experience.
So I I am a one woman show when it comes to my business.
That's amazing.
I don't have any co-owners. I definitely have an assistant, and I'm actually in the process of hiring a medical assistant. But I did everything on my own.
Okay.
I want two things I advise hiring or consulting, an attorney and an accountant. Definitely you want to consult with an attorney and accountant. But as far as if you want a business partner, you definitely can. But when it comes to having business partners, just be mindful. Your business partner has to be someone you can trust.
Yeah.
You just don't want to go out and find some random person and say, hey, let's start a business together. So I advise either it's a classmate, a colleague, a family member, someone who understands what you're trying to do as
Mhm.
far as starting a business. Um, but starting a business is not for the faint at heart. You do have to take on many roles and you definitely have to do a lot. So I make a joke. I'm the founder, owner, CEO, CFO, HR director. I'm everything when it comes to my practice. But as you grow, then you can consider, taking on staff, hiring a part-time assistant, hiring a part-time medical assistant. But that's things that come as you grow. That definitely is not it's not definitely not going to look like that in the first few months.
Sure. Yeah, that's all great advice. I'm learning so much. This is so cool. Any hardships or lessons that you feel like you could share, maybe mistakes that you made that we could
Oh, yes. Anytime you're hiring someone to do something for you, research them.
Mm.
Just find out, are they legitimate? Do they have a legitimate business? That's something I've learned from myself, especially before you pay someone any amount of money. I don't care if it's $1. Always have a contract in place when you are doing any type of business. Read the terms of your contract. That's something that I can't stress enough when it comes to doing anything when it comes to starting a business, especially as healthcare professionals. It's not something we learn in school. Nursing school didn't teach us how to start a business, or nursing school teaches us how to be a nurse. Same thing with MSN programs. Unless you're on like an administration route, you really probably don't know much about healthcare business. So that's something I mention a lot. I would say, you know what, nursing school doesn't teach you anything about running or owning a business. So these are things that you have to kind of go outside of your comfort zone and find. There's a lot of places where you can get free business classes
Okay.
that will teach you different things about running and starting a business. So you definitely, when you're starting a business as a healthcare professional, you're definitely going outside of your comfort zone, and which is something I had to do, because especially in nursing, we are taught to be so loving and caring and kind. But as a business owner, I've had to put my foot down a lot, especially when it comes to finances. So that's just something that you have to learn along the way.
Okay. Do you offer labs and x-ray in-house?
So I not in-house. What I do, my patients go to the lab and they're able to get their labs drawn. I could definitely draw labs in my office, but it's more convenient that the patient can schedule a labs, especially if they have to be fasting. That way, they just go to the lab and get their labs done. Same thing with X-rays and any diagnostic imaging. Patients are able to go to the radiology centers and get their tests done.
Mm-hmm. That makes sense. These questions were all submitted prior, so they're kind of choppy and don't really flow, but we're going to go.
Okay.
So from a financial aspect, do you feel like owning your own practice was a good move for you?
Financially, for me, it was a good move. So the great thing about starting a private practice is that you could do it part-time, and you could still work full-time and do the practice part-time.
Yeah.
And you could do part-time PRN work and still do the practice. So I think the great thing about any type of business ownership is that you can make it flexible for you.
Yeah.
For me, it was definitely, I was in a season in my career, in my life, where I knew it was time to move forward with starting my practice. And so now, because other opportunities opened up for me from starting my practice, it definitely is profitable for me. I probably don't know where I could find a job that will bring in the income that I bring in. Even through the pandemic, honestly, I was still bringing in income. But like I said, this is not something that happened overnight for me. So I just want people to realize it takes some time before your business can go autopilot.
Yeah.
And even I still do marketing. I still am marketing to get new patients, to do new things in my practice that will bring in more business. So it's really a never ending job. You're always going to be looking for ways to bring in more revenue.
So let's talk a little bit about marketing for patients. Where are you advertising? Where do you do that?
I do Facebook ads marketing. That has really been great for me, just
Okay.
because my patient population is like mid-20s to mid-40s, and that's the perfect age range for Facebook. Um, as opposed to, let's say, if you are wanting to serve the geriatric population, your patients may not be on Facebook. So
Right.
you may have to do like maybe old school marketing, posting or sending out brochures in the mail, which I know some colleagues that they do that for their practice. You definitely also want to connect with specialty offices because they need to refer their patients to a primary care provider. So there's all sorts of ways to do marketing. You definitely don't have to be a marketing genius to learn marketing. I definitely was not comfortable with advertising. I just had this misconception about sales and marketing. But now, being a business owner, I realize how important it is for your business.
Absolutely. So Felipe is asking, was it difficult and expensive to acquire medical devices?
Actually, no. That probably was not hard for me at all. So I definitely took advantage of finding refurbished items. So that's definitely something you want to do. You can even lease medical devices. You can lease exam tables. Believe it or not, you can lease an exam table. You can lease an EKG machine. You can buy equipment very inexpensively. Some companies will even give you like samples of things. Like, for example, a company sent me a bunch of speculums just to sample. So like I have more speculums that I'm doing pap smears just because they sent me. So there's ways that you can get equipment and medical devices inexpensively. And again, that's something that's very important is you don't want to just go out and just buy a bunch of things and then you never use them. So I actually buy things as I have a need for them.
Smart.
Yeah.
So that was actually leading into his next question. What were your steps to acquiring contracts for your medical supplies or finding the best vendors for your business?
So I am probably like the Google queen. I am going to search for a deal until I find the best deal.
Okay.
So if someone gives me a price, I'm going to see if someone can beat your offer. So as far as getting contracts with companies, you just have to reach out to the companies. A lot of companies they will treat nurse practitioners no different than if they treat a physician or a large healthcare system.
Okay.
You are still a consumer, and believe it or not, they want your money. So you just reach out to them. They have a sales rep that will reach out to you, set up a contract. That way, you set up a contract to get patients to get their labs done, a contract for patients to get imaging done, a contract to get your supplies. So you just look for the vendors that are in your area, and even like samples. Pharmaceutical reps, they'll visit my office, and they bring me lunch, and they tell me about their product. And so it's definitely the same way you would see it done in any other medical office.
That's awesome. So, do you have to pay for your inspections and such for your office setting? What does that look like?
So, for example, let's say biohazard waste.
Yeah.
The county, for me, I had to submit an application to the county,
Okay.
and so what they'll do is they'll approve your application, they'll send you your permit, and then they'll tell you someone will come out to just make sure, like simple things like you have your sharps container,
Okay.
and you have your manual in place to make sure that you know how to dispose of biomedical waste. Let's say if you wanted to set up a lab in your office, they will send someone out just to make sure everything looks right and inspect it. As far as like other inspections, just depends on what state you're in. Every state is different as far as if they need to inspect or if they don't need to inspect.
Okay. So, what advice would you give? Maybe just a few points of those who are wanting to start their own practice. What advice do you have for them?
The advice I would have is if you absolutely want to start your practice, you have to start somewhere.
Mhm.
I think a lot of times we as human beings, we like to procrastinate, or we let fear and doubt get in the way, and we probably think, oh, I can't do this. I don't think it will be successful. I don't think that I'll get any patients. But you can't have those thoughts until you at least try it.
Mhm.
So I would rather know I tried it than to say I never tried it and I don't know if I was successful. So I would advise that you definitely just have to start. You definitely have to be prepared for surprises, I would say, costs that you didn't probably expect before. And you definitely want to be smart and strategic about how you go about starting your practice, because you definitely don't want to go, obviously you don't want to go bankrupt, you don't want to spend all your money. And oh, just to put another thing out there, I didn't take out any business loans. I didn't use any business credit cards when I started my practice. So this definitely can be done with the income you are earning from an employer. It definitely is possible. So if you know there's a need for more providers wherever you live, your area, or you may have a business idea that you don't see anyone else doing it. Maybe there's a need that people are waiting for you. Patients are waiting for you to start this particular practice. So my thing is that have faith and just do it.
Ooh, you're inspiring. I love it. All right. So, what's the most difficult part? I mean, we're talking about the good stuff, and I mean, you've definitely shared some
Yeah.
struggles along the way. But what would you say is the most difficult part that we need to be aware of?
I think the most difficult part is the many hats I have to wear.
Yeah.
Like I said, I'm everything right now. I take, there's some things I have delegated, but in the beginning, I was doing it all by myself.
Mhm.
So a lot of us, even as RNs, we work with CNAs or patient care techs, and we're able to delegate things with them to them. Or if you're working as a nurse practitioner, you're able to delegate things to your medical assistant or an RN that you might work with. When you're in your own practice, you are it. You are doing everything. You are doing the follow-ups. You're taking the vital signs. You're charting. You're doing the referrals. You're doing everything. So it that definitely can be a challenge
Sure.
because you're wearing a lot of hats and you're taking on a lot of roles. But if it's worth it to you, then it's rewarding.
That's great advice. So, Philip wants to know how he can contact you. So, why don't you tell everybody about your side hustle, essentially? But maybe it was your first hustle. I don't know, girl. You've got a lot going on. So, just tell us how we can contact you and what resources you provide, and what kind of services we can reach out to you for.
So, okay. So, as far as contacting me, I am on Facebook. You can find me via my personal page or my business page, which personal is Jessica Chung. My page is Dr. Jessica Chung. And you can contact me by email, my phone number, my website, www.drjessicachung.com. All of my contact information is there. And I also just started a new project, which is the International Business Association for Nurses, which is basically going to be focused on helping nursing professionals start and grow their businesses. So I'm doing a launch in a couple of weeks, which will be a live Facebook launch. And I'm just going to have other nurses that are entrepreneurs come on and share their story, because I don't want people just hear my perspective. I want people to hear other perspectives. So you can find also on Facebook, International Business Association for Nurses, if you want to join in on that endeavor as well.
Awesome.
As far as if you want to reach out to me for one-on-one, I do one-on-one consulting and I do group consulting as well. And I actually have my next nurse practitioner workshop coming up, which is a half-day virtual workshop. It's on July 25th. All of that you can find on my page as well. You can register. Tickets, early bird tickets are available right now. And so that is also a way to help you jumpstart into starting your own practice. So I give a lot of tools. I give a lot of advice. I show you how to do things all on your own as far as starting your own practice. So I have a lot that I do, but I'm always available if anyone has questions, if you reach out to me.
That's so great. Thank you so much for all this really applicable, useful, productive information. Would you say that conference is more geared towards nurses who are already nurse practitioners versus those who are looking forward to that?
So I've actually had nurse practitioner students
Okay.
in that workshop.
Okay.
They've taken my workshop. So I don't discriminate. If you know that you want to start a practice, by all means get the knowledge and get it early. One thing I wish I would have done is I wish that as soon as I had like got into nurse practitioner school, that I would have started looking into starting my practice.
Yeah.
So if you are a nurse practitioner student, by all means, you can definitely join in. Now, for my nurses who maybe you don't want to start a practice, maybe you want to start some other type of business. The International Business Association for Nurses will be focused on helping nursing professionals start whatever business is that you want to start. So maybe you want to open up a assisted living facility, maybe you want to start a CNA school, maybe you want to start a scrub line, whatever you wanted to do, that organization is focused on that.
I love that. That's amazing. All right. So just tell us, last thing, what you're most looking forward to in your career.
I think I'm just looking forward to growing and advancing. I always have like so many ideas and things I want to do. So and I think where I am right now is that I am also focused on helping other nursing professionals grow, because I've seen, especially during a pandemic, it's sad to see, nurse practitioners getting laid off and furloughed. And I'm just thinking, wow, if you are in a position where you can switch gears and focus on building your brand or building your business, then it won't be such a space where you're wondering what you're going to do next.
Yeah.
So it's not, and what I want to kind of tell people, it's not if this happens again, it's just when. that something like this could happen again, and you want to be in a place where you are financially secure, that you are not dependent on a job, and that you can switch gears and focus on, you know, generating income through your side businesses.
Yeah, absolutely. I love that advice and I love your vision. All right, we're
Yes.
going to close. We thank you so much for joining us today. To everyone who tuned in, thank you. Have a wonderful day. See you later.
Thank you, everyone.
Bye.
Bye.